Georges Benjamin, Executive Director of the American Public Health Association. Dr. Benjamin, in the context of public health, you quote a comedian, Moms Mobley, who says, if you always do what you always did, then you'll always get what you always got. Explain that in the context of public health.
Well, we spent a lot of time worrying about health care and not enough about the things that really, really influence our health. And so if we keep doing the same thing over and over again, we're going to get the same outcomes, which is spending twice as much for health care and not getting the best outcomes that we can.
Okay, yeah, that figure, you said we pay twice as much as other industrialized nations for health care and we live shorter lives. I know it's a really complicated answer in some ways, but how could that be?
It's because many of the things that influence our health are outside the health system: access to food, whether or not you can actually get up and exercise, whether or not how we're made, certainly, whether we smoke or not, whether we eat healthy. All of those things influence our health, as well as, of course, access to health care.
Okay, and of all the different factors that have an impact on somebody's health, what percentage of them are the healthcare services delivered within the walls of a doctor's office or a hospital versus all the other factors?
Only about 10% of what makes us healthy is due to the health care. The other 90% are things like our environment, the things that we do, our educational level, things of that nature.
Okay. You also say that place matters. Explain for me what that means in the context of healthcare.
Well, we all live in communities, and when you get up and you look outside, look at what's in your community. Whether or not you have a community that's walkable, bikeable, green, whether you have access to good schools, whether you have access to a grocery store in your community, all of those things matter, and too many of our communities don't have those vital necessities.
Okay, and you talked about you showed a map of the Washington, D.C. metro system, and these maps exist for other cities, and that shows that people on one end of a particular line have one health outcome, people on the other end have a far different one. Can you maybe explain that for me a little bit?
Yeah, there's many our scientists have done these maps which show communities, and the way of graphically showing them, for example, is to show the train lines. And what you'll see is one end of the train line in the central city where people die at one rate. So, for example, Washington, D.C. at a rate of 72 years, and folks that are living maybe only 20 miles out have a 10-year difference in life expectancy, meaning they live 10 years longer. And that's a big difference in life expectancy for such a short difference.
Okay. Now talk about the preventable causes of death. What's the number one most preventable cause of death?
The number one preventable cause of death is absolutely tobacco use. We call it public enemy number one, and the tragedy is we can do something about it.
And what kind of progress has the country made in actually reducing tobacco usage and reducing tobacco-related deaths?
We've had enormous improvement in tobacco-related deaths and actually tobacco usage, particularly among our kids. Not as much as in adults as we would like, but we still have a long ways to go. We're still over 20% in some communities where we have tobacco use, even in our kids.
Okay, and finally I want to ask you about how much of this gets covered in the media. The social determinants of health issue versus all the other healthcare issues, the politics and the policy. How much of the social determinants gets covered and how much of the coverage is about all these other things?
The interesting thing about the social determinants of health is they never get covered as a health story. They get covered as a crime story or an economic story or some other issue, a zoning story. And the health impact of that story never gets brought into this very, very important story. And we're hoping that reporters will do more of trying to link the social determinants of health to some of these other stories.